So let's take a look at exercise training in heart disease. So this would be an example of someone with a maintenance type of program. Once someone has been in the hospital, they are going to do an inpatient cardiac rehab. They're going to have them walking around as quickly as possible and to try to build up their stamina after being so ill. So remember, we're talking people who are seriously ill and then they've maybe had a major surgery or a major procedure if it's been an angioplasty. Then sometimes people will be referred to an outpatient cardiac rehab. Medicare is going to pay for 36 sessions. So they may or may not have gone to that. Once they are released from that, then they're coming to us. So what do we do with them? How can we work with the ACSM guidelines? So frequency still 3 to 5 days per week, just like any other healthy adult, but daily physical activity is encouraged because people will sometimes do nothing if they are not actively doing their exercise program. Intensity, in 60 to 80% of their peak heart rate. It's not appropriate to do a target heart rate for people who use beta blockers. They cannot raise their heart rate. So you're going to have to use the Borg scale perceived exertion of 11 to 15 to check their intensity. So you don't want them going higher than a 15 on the 6 to 20 scale. Time, once again, just like everything else, 20 to 60 minutes. The type, the mode, rhythmic activities, preferably where we can control the intensity and monitor the intensity. You can set the speed and grade of a treadmill or the watts on the cycle or a rowing machine, new step, other types of cardio equipment. A lot of folks, especially some older adults, they are a little intimidated by the elliptical, although some folks may be perfectly fine with going and using the elliptical. The volume, again, they may need to start with 10-minute bouts and gradually work up to those 20 to 60, 30 minutes, continuous bouts. And then their progression is going to vary on their condition. Some people, maybe they haven't had a real difficult course with their heart disease. Maybe they're going to be able to progress a little more. Some people, especially those that are higher ages, may need a much, much slower progression. So you have to keep that in mind and really individualize it for each client. Lots of times they think, people have had heart disease can't do resistance training. They definitely can do resistance training. So just follow basic ACSM recommendations. Start them out with 2 to 3 days a week, 10 to 15 repetitions, so a little bit higher on the 1RM, 8 to 10 exercises for major muscle groups. And, they may like the machines, they may like tubing, Dynabands. So typically, once they've been released to a maintenance type of cardiac rehab program, they're good to go with resistance training. You're normally going to have physician approval. Anytime you have somebody who's post-heart disease, post-heart attack, angioplasty, you always want to make sure you have physician clearance on that person. And we talk a lot about that in XPhys too. So let's move on and talk about heart failure. We showed slides in the beginning of the class and said, well, heart failure is the decreased ability for the heart to pump. It can happen on the left side of the heart, the right side of the heart, or both. So unlike an athletic heart that is enlarged and the left ventricle increases the stroke volume to pump blood, people who have heart failure, their heart is enlarged, but it's very inefficient. Because the heart can't pump blood, it tries to enlarge itself to try to pump, and it just gets further inefficient. Dyspnea, difficulty breathing, so especially when lying flat. So people who have heart failure oftentimes have to sleep propped up. People who have dyspnea also will have a dry, hacking cough. So that can be a sign of heart failure. Extreme fatigue, so unusual fatigue with normal daily activities. Edema, swelling in ankles. Now, not everybody who has swelling in ankles has heart failure. It could be from other conditions, but that can be a sign. and the reduced ability of the kidney to handle sodium. So you can see how all this plays together with the edema.